It's been more than a month since the federal government even allocated more Johnson & Johnson vaccine to Ohio, but providers like Columbus Public Health out here at the Celeste Center are still struggling to clear out their supply. Doctors tell me that extended expiration date is providing some relief. This week, the FDA giving new life to millions of doses of the Johnson & Johnson vaccine.
The lengthening of the expiration date were based on stability studies where they actually measured the ingredients in the vaccine to make sure that everything was still active and stable.
U.S. regulators now say the shot is good for at least 4.5 months instead of 3. The announcement comes just days after Governor Mike DeWine called on providers to quickly distribute 200,000 doses set to expire on June 23rd.
The worst case scenario is having to waste these vaccines if they're past their expiration date.
Ohio Health infectious disease specialist Dr. Joseph Castaldo explains the extension buys time before that worst case scenario. Now he says we must use it wisely. The state is working with providers to reduce barriers and bring the shot directly to people who still need it. So far, J&J has been used for about 11 million of the 140 million Americans vaccinated. Castaldo says anyone still hesitating to trust the one-dose shot shouldn't worry.
There is a very robust mechanism in place to look for any safety signals that may pop up. That mechanism is working.
But he also recognizes slowing vaccination rates mean providers have their work cut out for them.
If we get to 70% by 4th of July, that is a Herculean task that initially, when I first heard about it, I thought we would never get to. So I hope I'm wrong.
Now, both Pfizer and Moderna have a shelf life of about 6 months when stored frozen. The state is telling providers that have leftover doses of J&J to set those aside for stability studies. Local for you in Columbus, Catherine Ross, NBC4.